Thank you, Luis. So then, my talk is a little bit switched to the imaging. So now my background is plastic surgeon trained in Japan, and then so most people believe so the surgeon knows a lot of the things because they are taking care of the cancer and also the performing the lymph node dissection. But actually, so when I rotating the breast cancer oncology, so then only the little knowledge about the lymphatics. And then my motivation is, so I started the anatomical study of the lymphatics when I joined to the University of Melbourne and since 2001. And then things have suddenly changed in my life. So now I understand. So only the little study has been done about the lymphatics. So that's why I think lots of the things need to be done for the lymphatic research. So now the lymphatic research is the one of my specialty. And then, so these are the imaging devices. So it's the style is different. The one style is a handheld, and then another one is a standing used in the operation theater. But so these are the devices mainly just working at like a night vision. So something cannot be seen in the naked eye. It's possible to use in this camera system. So when I started this system in 2009, it's so excited because there is some connection between my anatomical knowledge and the actual image in the clinics. So, but it's not only also need some of the contrast medium to see the lymphatic system. So that's why it's not the little bit invasive procedure. So the dye called indocyanine green, so is to be used. So this dye already being used for the clinics for the 50 years, but it's not lymphatic application. It's application for the vascular imaging. But one day, so the Japanese doctor named Uno, he's a vascular surgeon. So instead of injecting into the vein, so he injected into the skin, and then find so this dye can having the potential to image in the lymphatics. So once he published, so lots of the people, especially for the plastic surgeon, they start using this imaging to understanding the lymphedema more. So this is a video showing the image of the lymphatics in a normal condition. So injected into the dye into the glantier to see the lymphatics. So lymphatics is showing like this line. So what we are seeing, so the left is a schematic diagram of the lymphatic system. So lymphatics start as a lymphatic capillary in the skin, and then straight goes down, and then connect to the big lymphatic channel running it in the fat tissue. So this imaging showing this layer of the lymphatic channel. So then, so one of the key to understanding this imaging is the word dermal backflow. So I'm going to show you what is dermal backflow is. So here is a medial side of the forearm. 2 injection has been done in the medial wrist. So the normal lymphatics is show up and then suddenly stop. And then when magnified in the image, so you can see like a spider net. So what's happened is, so this lymphatic vessel is more fragile for after the operation. And then some of the lymphatic channel is blocked. And then, so the lymph fluid is reflux, is going to the skin from the deep to the superficial. So using skin networks to try to carry the fluid. And then simultaneously, if there is these spot, the patient feel like some discomfort or some of the congestion. So here is a mild, the patient in the mild condition. So you can see the line and then stop here. So then start the lymphatic capillary. Fluid is going to the superficial lymphatic capillary, and then so moving towards the lateral side of the forearm. So sometimes they ask, so these are the bad sign, but it's actually a good sign. So now it's switched to the normal lymphatics in the lateral side, and then so carry the fluid is proximal. So when the unusual condition, like operation, and then some of the lymphatic vessel is blocked, and then body accommodate in a new condition, and then try to find a new way to carry the fluid. So what's happened is, like here, it's blocked, and then reflux come to the skin, and then switch to the other patent lymphatic channel. So body is so clever. So he tried to heal by itself. But things is getting more severe. So then there is no patent lymphatic channel. So all the big lymphatic channel is blocked, and then small lymphatic capillary is taking the role to carry the fluid. And then these are the small lymphatic channel. That's probably the reason. So it's going to be overload. So that's why having some swelling. So then this imaging can be potential to distinguish so which condition of the patient is currently. So because if talking about the lymphedema, each individual condition is different, and also harder to discuss it with share the same information with the clinician and the therapist. But this kind of the imaging having a capacity to telling what the condition of each patient is. So it's a clinical application of this imaging. So there is a surgery called lymphovenous anastomosis. So this is a new surgery. So already published in the 1970s from the St. Vincent's Hospital in Melbourne. It's a Professor Bernard O'Brien. Actually, these kind of the lymphatic surgery is populated in the Australia more than 40 years ago. So, but this operation is faded out. The reason is, so finding the lymphatics is blind. It's very, very difficult. So finding the needle in a haystack. So it's absolutely nearly impossible. But now the imaging technique is available. So then we using a couple of the different imaging systems. First, using the venous mapping, so to map the vein, and then also doing using designing green for the lymphatic mapping. So then these are the scanning. After the scanning, 30 minutes later, and then so because then now the red color is a vein, and the green color is a lymphatics, and then these crossing points can be the potential site of this operation. So this is one of the patient underwent this procedure. It's not a severe condition, but have a look at her feet. So there is the swelling in the ankle region. So then right side is after the operation. So then previously haven't seen the contour of the Achilles tendon, but can see in after the operation. It's not a huge differences, but so this operation having the potential to rerouting some of the excess fluid to the venous system. The another application is, so we just combining with this imaging with massage treatment, because there is some debate. So massage can help or massage is less help, so nobody knows. But so these patients, so working the therapist, the Asha, so then Asha is applying the massage for the patient in the upper arm. Here is the upper arm. So then actually the massage can facilitate in the movement of the lymph fluid. And then after the apply the massage, so then this one is connected the lymph node in the intact area. So here is a collarbone, here is the chin. So then leads to the supraclavicular lymph node. So then this patient probably the actually pathway is normally the lymphatic is connected, is blocked by the surgery, but the body accommodating the condition and then finding a new way to drain the fluid. So then this imaging having the potential to navigate, so how to apply the massage. So because without seeing any of the imaging information, so then it's very hard to understand, but having a potential. Then what we are doing in our clinic is after the patient we're scanning, so I'm making hand drawing. And then, so these are the imaging, the still image. So then what we've seen in is, so, and also taking the photo of the patient. So these are the dermal backflow area. It's like a spider net like the area. And then some area having a good lymphatic channel. And then these applications are, so we can identify where the congestion area. So these are the pretty much correlate with the patient feel discomfort. So, and also the different hand pressure. So then these are the good lymphatic channel. It don't need a big pressure. So just a gentle massage is enough to carry the fluid. But these areas need to apply a little bit more pressure. So otherwise, lymph fluid goes through the tiny capillary. So, and then, so finally, so then these directions showing where the congestion fluid is need to be moved. So we just keep on doing this study at the Macquarie University. So this is one of the diagrams, so it is provided by the jobs. So this is showing a pretty accurate anatomy. So then if you have an interest, so you can pick up for your the gift today. Thank you very much for your attention.